For some cancer patients, the information provided by studying a person's genes will save their lives. Genomics not only gives doctors more insight into each person's cancer, but also provides understanding into how the individual's cancer may progress and possibly respond to treatment. It is the cornerstone of research designed to develop genetics-driven targeted therapies, the foundation of precision medicine.
Cancer is caused by abnormalities to the genetic information inside of cells, or what we call DNA. And these abnormalities or mutations end up causing the cell to behave differently than it would ordinarily. And usually what happens is they start to grow uncontrollably. And then that eventually leads to what we call cancer, which is an overgrowth of abnormal cells. In some cases, the immune system can capture these abnormalities in the DNA and these mutations and keep them from growing. But in many cases, especially once patients have cancer, the immune system can no longer keep it in check. And so the cancer develops to the point where it can be detectable, and then people know that they have it, and that's when they start to seek treatment. So genetics and genomics are terms that are being used commonly now for cancer. And they're somewhat confusing because there is some overlap between them. Genetics is the study of the DNA inside of a cell, and it can refer to genes that are passed from parents to kids. That's one part of genetics. The other part of genetics is when we think about what are the genetic abnormalities inside a particular type of cell, a cancer cell, that can cause it to become that way. So often when we talk about genetics in terms of cancer, we're talking about mutations or abnormalities within the genetics of the cancer cell that have helped it become cancerous. And this sometimes can help us define a treatment or maybe a particular drug that we can use to treat a patient with cancer. Genomics is a related term, and genomics actually refers to the study of all the genes and all the DNA in the cell. So genomic studies can help us identify genetic abnormalities in cancers. And what genomics is doing is that it's really accelerating the pace of identifying mutations that are important for cancer. And this is important because the more we can understand cancer, the more we can understand that there are specific differences between different types of cancer, even the same type of cancer. All of this information is becoming more and more critical to develop better treatments for cancer and improving the outcomes for patients. There are different ways to try to identify the specific mutations for each cancer. And we use genetic testing as a way to understand abnormalities or try to identify abnormalities that we know exist for a certain type of cancer in patients. There's a few different ways of doing this. There's not one way. And typically we do look for large changes to the DNA, rearrangements of the chromosomes. This is what we call cytogenetics. We also use a procedure called FISH, or fluorescent in situ hybridization, to understand these large changes in the chromosomes. Complementary to this, we also look for much smaller changes in the DNA. And this is usually done with sequencing, although not exclusively. Genomics is actually a way of looking at all the DNA in the cell. And in theory, genomics could be used to look at all the changes that could be found in the DNA, both large-scale changes that we normally test with cytogenetics and smaller changes that we test with targeted sequencing panels. Understanding all of the mutations that are there and all the genetic abnormalities that are present in a cancer cell will help us figure out better ways in the future of developing specific therapies for certain abnormalities in cancer. And this is something that we call precision medicine. Researchers hope that one day, testing for mutations this way will help identify the best and most effective treatments for the patient's disease.
To get the best information about new testing and potential new treatments, it is important to talk to your doctor. Sharing your questions and concerns can help you get the best care possible. Lindsay, an acute myeloid leukemia patient, is about to begin a telemedicine visit with her physician, Dr. Trayer. To help her in her conversation, She uses a technique called PACES, which consists of 5 key skills. P. Present information. A. Ask questions. C. Check understanding. E. Express concerns. S. State preferences. You may not use every skill in every visit, but using the word PACES will help you remember these skills. Let's see how Lindsay utilizes PACES while talking with Dr. Trayer about genomics and genetic testing.
Good morning, Dr. Trayer. Thank you for meeting with me and talking with me. Since I was diagnosed with AML, I've been doing some research and I joined an online chat group. Some key words that have been popping up are genomics and genetic testing. Can you tell me a little bit more about that and how that might go into my treatment plan?
Yeah, no, happy to talk about that, and I'm glad that you brought that up. It's a really great question, and there is a lot of information out there. And it's important, actually, for your treatment to sort of understand the role that genetics plays. So genetics is the study of the inherited material inside of the cell, basically deoxyribonucleic acid, or DNA. And there can be changes to this, what we call mutations. And so understanding the mutations that lead to somebody's leukemia is very important. Now, genomics is a similar type of term, and it's really just the study of all the DNA within a cell. It's the genetic changes in your leukemia, sort of the things that not necessarily you were born with, but things that happen to your blood-forming cells that we're really focused on in terms of understanding your disease.
Okay. Another key word that's popped up too is precision medicine. What exactly is, obviously I know what precision, precise means, but can you tell me a little bit more about precision medicine?
Yeah. Precision medicine is really related in part to the genetics of leukemias, in that we've been able to identify certain mutations, certain genetic abnormalities, and actually develop drugs that are specific for those mutations. So that's where the precision part comes in. So we wouldn't necessarily use these drugs for everyone, right? We would only use them for the patients who have leukemias with particular mutations. So it's really...
Okay. So knowing my specific mutation will determine what kind of treatment that I will most likely go with?
It may actually define a particular drug. In some cases that we can find like a new drug that we wouldn't have used otherwise. In some cases it will help us understand how your leukemia will respond to chemotherapy and whether or not we should think about something called a bone marrow transplant or stem cell transplant. In some cases there's not anything we can do about a particular mutation, but we can use it to sort of track the disease. So we use it for a lot of different reasons, but it's important for us.
Okay. And then are there side effects or concerns that you might have if I decide not to do the testing? I just want to make sure and get the best treatment. You know what I mean?
No, I totally understand. And I think it's important for us to look at the genetics because it makes such a big difference in how we treat it. We encourage everyone to get this genetic testing. And again, I think sometimes people feel a little nervous that we're interested in sort of the things that, inherited things that might have led to cancer. But most of the time, actually, we're interested in the mutations that happen to the cells in your body that cause the cancer, that things that you weren't born with, but that happen during the course of your life. So it's basically a standard of care now to do a large panel of genetic testing. So it's very helpful in terms of how we treat and monitor the disease.
Okay. And the testing isn't painful or doesn't take super long. I just want to make sure and get the right treatment as quick as possible.
Yeah, no, it doesn't hurt at all. We take the material from either the blood or when we do the bone marrow biopsy, and so it's not really an extra procedure. It's just using the same cells to basically get the genetic information. But it's really become a kind of a critical part of leukemia treatment to understand the genetic abnormalities inside the leukemia cells.
Oh, yeah. And especially as a patient, when people talk about genetics and obviously now genomics, I have young children. So, of course, in the back of my mind is, oh my gosh, is this genetic? Are my kids going to have to worry about this later in life? So, thank you so much for all of your information. I wrote down some stuff, and I definitely am going to talk to my family. I'm sure they're going to have more questions too. But thank you so much. I appreciate it, and this is very helpful.
Yeah, no, I'm always happy to talk about this, and I think it's great that you're asking these questions. And I would really want to encourage you to write down questions if you have them, or talk to your family, and make sure that everybody feels like their questions are being answered.
Before you go to the doctor, think about what you want to talk about. As a patient or caregiver, it is your right to ask questions. It is a good idea to think through what you want to know and write down your questions before your visit. Lindsay was able to make the most of her short time with Dr. Trayer by preparing for her visit and utilizing PACEs to promote better communication. It is also important that you check your understanding by asking the doctor to repeat or clarify information. Tell your doctor your preferences for information and treatment, so together you can make the best decisions for your care. For more information about genetics, genomics, and precision medicine, please visit the Leukemia and Lymphoma Society's website at lls.org or contact an information specialist at 1-800-955-4572. LLS has clinical trial nurse navigators that can assist you throughout the entire clinical trial process and are able to utilize your genomic profile to find the most appropriate clinical trials for you. For more information, visit lls.org/navigation.